For all the elders, my obedience, my brother, elder brother, the guide of FOSWL, Ananagar, I owe a lot to him, and my special pronouns to him. Warm introduction by Ananda Kumar Garu has made me more humble. My special regards to him. My elder guide, I call him Appa, T.H. Ayyar Garu, is here, and I seek his blessings at his feet. Again, I remind all of you that we are sharing the knowledge which is already available. So it is nothing, it belongs to us. And the association with ML Swamigaru to me is rather very heartening. And he has been instrumental in making me the key speaker in more than half a dozen flat fora in United States, in Cupertino, Milpitas, San Diego, and other places. And I owe a lot to him for the inspiration and the guidance that Sri Swami Garu and Amma Rangamani Garu has bestowed on us. This picture is one of the wonderful memories I had when I was the disciple of Swami Garu and as a speaker of that particular day in Cupertino. Now, let us quickly go into the topic. Much has been said about this person whom you are seeing here as the speaker, and a lot of accomplishments have been listed. But what we need to understand is that these responsibilities are given to us by the Almighty. And He has chosen us to do these things. And it is not our glory or our achievement that we have got to do all these things on the ordering and ordained duty by the divine. Now, I always have a feeling that we should submit whatever we do to the Almighty. Ishvara Samarpana Bhava Idam Api Namama. Even this talk is dedicated to the Almighty who made us what we are, and also to the Gurus who made me stand before you today as somewhat in a role of advisor or counselor. So needless to do more introductions. Now, this is a great topic. Cancer awareness is a very essential topic that all of us are looking forward to know some basics. At the same time, please remember, this is not a consultation platform to give anyone any specific disease-related advice of their or their kin. At the same time, some general principles of understanding will be presented, and any discussion on this topic, I welcome only in a general way and not in a specific way. If some of you have anything to ask me, I write my number here, 93805-2121-221. You can interact with me and make me an instrument in making life better and use my services. My humble pronouns once again to the august audience of FOSWL who are very learned in their own fields. There are some medical people also here, and I urge all of them, all the doctors here, to bear with me because this lecture is going to be to the non-medical audience, and as such, it may not throw a very great light to their knowledge. Nonetheless, there will be a flavor that you can enjoy. So here is the message, an international message on National Cancer Awareness. Every year we celebrate it on the 7th November, and if possible, we will have a camp of cancer detection by a FOSWL if our president and my brother wishes so on the 7th November. Early detection saves lives. This is the message I have got. So please note down the number for me to be useful to you whenever God asks us. Cancer awareness, prevention, and screening. We're going to touch upon 3 topics. One is the cancer awareness. The other is the prevention, and of course, the screening. Okay. What is the objective of this talk? Look here on the right hand side, you see a picture of a breast with so many glands. These are the glands in the breast, normal breast glands, which give us milk. Drinking that milk, we became like this as adults. And these breast glands, when they become cancerous, they will look like that. Then you would like to know what is cancer. Normally, there is a cell growth and cell death happening in the body. The cell growth and cell death are regulated in such a way that the growth never exceeds the requirement. But what happens? Who is controlling this? The divine will in one way. And there are microcomputers in the body who control the cell growth and cell death. Every day, millions of cells are dying, and equal number or required number are being renewed and reproduced every day. And this is an intricate biological mechanism all of us are endowed with, without which we would not have seen the light today. But then there will be instances where this regulation, which is called the auto-regulation of cell death and cell growth, is rather disturbed, and certain cells do not obey the commands of the body and start growing on their way, their own way, and in the process, they endanger the normal cells, they outsmart the normal cells, they become bigger, they use their nutrition, and they produce all sorts of symptoms. That is what is meant by cancer. So there are some early warning signs which we will see very clearly. And important thing is, as age advances, the risk of cancer becomes more. It's understand. Promote self-examination. Here, I'm going to show you some pictures of the biology or the anatomical things. Don't be embarrassed, because it is important to learn about what is inside our body as much as we see outside. We, as individuals, are sometimes embarrassed to talk of our problems in the private parts, in the breast, in the genitalia, with the result the disease has already progressed and they will not have a chance to get a proper cure. So I urge all of you, what is called self-examination of the body as a whole, not only looking at the face in the mirror, looking at yourself as an individual completely, what is not visible, use a mirror and do self-examination. Never ignore warning signs. What are they? We are going to see shortly. And the moment you see some deviation in the appearance or behavior of the body parts, you immediately seek prompt medical attention. And of course, cancer demands lifestyle change. That also we will see. Have a robust health insurance, because today every treatment is very costly, the equipments are very costly, and the interest on the equipments are so high. We often blame the hospitals that they're enormously charging, but we never understand how much pain they undergo and how much debts they take to establish these equipments. So best thing is have a robust health insurance. When I say robust, I expect at least 20 lakhs of insurance for each individual. For a couple, 40 lakhs of insurance. If you pay a higher premium, doesn't matter. It will come handy when it is required. Some of these things may be, for non-medical people, they may be little more than what is required, and don't be frightened. None of us are going to have them just like that unless God wills, and also unless the body's autoregulation is disturbed. And what is the reason for the autoregulation to be disturbed? When we take care of the early signs and warning signs, and we change our lifestyle, and we stick to the basics of health, prevention and health protection, there is no need to be frightened. Fear is the last thing that one should entertain in the mind for anything. Okay, what general information? Look here on the right side. You have got a cancerous cell. You can see a lot tails-like thing. It outgrows the normal cells. In the process, it occupies their space. It eats their food. It uses the blood required for the normal tissue. It uses all the nutrients and oxygen. So much so, the normal tissue of that particular body will not be able to function as a normal entity. Suppose there is a cancer developing in the liver or kidney, whatever it is, naturally the cancer cell will rather outgrow the functional ability of the organ, and the functional ability is compromised, and then the structure is disturbed and you produce lots of symptoms. So I told you what is cancer. Irregular or unregulated or dysregulated growth of unnecessary cells. Are they helpful? No. Can they function? No. They don't function. They interfere with the function. They consume the nutrients of the functioning people. So we need to know what are the common cancers, what are the ranks in terms of number of cases we get, in terms of the lethality of the cancer. Cancer can be cured. This has to be the watchword for all of us. 25 to 40 years ago, it was not. Today, if it is detected early, cancer can be cured and definitely useful life can be prolonged. Another important aspect of cancer is it is painless. Unlike your abscess, unlike your wound, unlike your fever, it doesn't show up very much and doesn't force you or demand you to see a doctor. It is painless. Many patients will tell me, sir, I never had pain. That is why I did not come. That is the very nature of a cancerous growth. Early detection is the key, not to ignore the warning signs. Of course, the lifestyle, smoking, alcohol are the primary culprits for most of our diseases, and not to say that cancer is an exception. It is not. Smoking and alcohol very much are integral part of cancer causation. Another thing is most of us, particularly in India and South India, Southeast Asia, heaps of rice we put in our plate and no fiber is added. Morning, arsi dosha, arsi idli, arsi idiyappam. Afternoon again, rice preparation. Night again, rice. All that is white is fiberless. Maida, rice, ghee, and all that. How do I have fiber? More vegetables, green vegetables, cut vegetables. The more colorful your plate, the better. For a change, white is not the choice here. It is the color that is the choice, and add fiber rich food. And we always consider fruit as something very extraneous. Make it a habit. 3 meals a day, all the meals, there must be at least 2 servings of fruit. One serving is 550 grams, 2 servings is 100 grams. So minimum 300 to 500 grams of fruit should go inside our body. That prevents many diseases, including cancer. Needless to say about obesity. If we are obese, no question, every disease will try to take advantage, and cancer is no exception. Another important point that I would like to say is family history. Certain cancers, not everything, not all, certain cancers run in families. For example, the lower gut colorectal cancer, the breast cancer, some of the cancers run in families. And it is important if our kin or our mother or father are suffering or suffered from the diseases like cancer, we inform the doctor so that they will take care about the family genetic background of the cancer. Okay. Now I'm going to show you some 18 important warning signs and symptoms of cancer. And these are persistent cough or blood tinged sputum or saliva, either in the vomit or in the cough, blood tinged sputum or saliva. When I am running through this list of 18, you people will be thinking about your own self. I know, but not all these symptoms or any one of them is specific for cancer. There will be several conditions which can cause persistent cough or blood tinged saliva, like a simple mouth ulcer to cancer. So what I have to do, I remember that this is a symptom, not to be alarmed, but be aware and take necessary help and approach the medical profession. Whoever is your doctor, first believe in yourself, second believe in God, and three, believe in your physician. If you don't do that, don't go on having third opinion, 10th opinion. Of course, when it is required, they themselves will ask for a professional opinion. Be faithful and be having the Shraddha or whatever is that to your three things: on yourself, on the Almighty, and on the physician. Blood in the stool or frank or tarry dark blood. Of course, I forgot to tell you about the second one: change in the bowel habits, either diarrhea or vomit or constipation. If I am habituated to have a particular bowel pattern, if that is changed to constipation or diarrhea, or sometimes pencil thin stools are suggestive of, I said suggestive of colonic cancer. Unexplained anemia. You check your blood counts annually, blood counts are low, hemoglobin is low, RBC count is low. Yeah, there must be a reason. And for no reason, we will become anemic. Unexplained anemia should always excite the important awareness that it could be malignancy. A lump in the breast and or a discharge from the nipple of the woman of any age could be cancer. Not always, you know, a frightening thing, but at the same time should not be ignored. There is what is called SBE, self breast examination. I will show you in another slide about that. Lumps in the testicles of men for self examination. Keep observing during your shower about your own private parts and see that they are as normal as earlier. Urination, change in the urinary frequency and decrease in the stream or force, particularly in men, is an important symptom. Blood in the urine, hoarseness of voice, change in voice, as though தொண்டை கட்டிக்கின மாதிரி பேசுறது. Something like, గొంతు పట్టేసినట్టు ఉండడం. Hoarseness of voice. Persistent lumps or swollen glands in the neck region here or in my armpits or anywhere, the swollen glands have to be looked. Each time when we take a shower, pass your hands on the neck, the back of the neck, the armpits, and then in the groins. If there are any lumps or glands, please bring it to the notice of your doctor. Indigestion, not able to eat properly like earlier, and difficulty in swallowing is a very important warning sign. Obvious change in a wart or a mole becoming bigger, darker, or getting raised up from the skin, or a wart, some small mural மாதிரி இருக்கும். The warts, they become bigger, that's again. Unusual vaginal bleeding. When I say unusual, not the regular periods, unusual vaginal bleeding and the discharge from the vagina. Weight loss, unintentional weight loss, night sweats, or prolonged fever could be a warning sign of cancer. Persistent itching in the anal or genital area, be aware of it. Persistent itching in the anal and genital area, sometimes hives, red raised patches, urticaria we call, you feel like scratching. That could also be a warning sign of underlying malignancy. Non-healing ulcers or sores. Normally, a sore should heal in a matter of 7 days. Worst scenario, deeper sores, maybe 2 weeks. But if the ulcers are not healing, then you are in for trouble. Persistent unrelenting headache. Unrelenting headache, one reason above 60 years, unrelenting headache is one indication for evaluation to rule out cerebral aneurysms and then hypertensive changes in the brain and of course malignancy. Back pain of unknown sort of cause, pelvic pain and bloating of the abdomen are also causes. So if I have listed you these 18 symptoms, this is for you to keep yourself a watch on these symptoms and signs and not to be sort of carried away that any one of them, I had a little bit, one drop of blood in the urine, maybe it is cancer, not to be afraid of. But if you think that the thief has entered into the body, if you have a suspicion, what do? You check. And if the thief is not there, very fine. Thief is there, you catch him and arrest him. Same way here also. We take care and not be carried away that it is cancer already without it is being confirmed. Okay, now this slide depicts the self-examination. I'm going to share the PDF with you. These are very small sort of print. But anyway, I explained the first step is stand in front of the mirror like that, both hands like this, then raise the arms onto the back and see, look at your breast completely and keep the thing on your waist like this, and then let the breast drop down and see whether there is symmetry or not. Then during the shower, keep one hand up and use the other hand, left hand for the right breast, right hand for the left breast, and gently but firmly palpate or touch the breast deeply, whether there is anything within the breast. And this self-examination has saved many lives. They don't do that. And again, when you sleep on the bed, turn to your side and again look at the armpits and look at the breast. This is called the self-examination of breast, which is a highly essential. Every young girl, after she enters into the reproductive age group, she must be taught how to self-examine the breast. More so women who are above 30, 35. And if you were to do a service, giving food, clothes, and then working during pandemics or working in floods is okay, but you can hire, adopt a village, go to the village, give them some basic education about menstrual hygiene, how to prevent anemia, how to self-examine the breast. So many health issues are there that itself is a great service one can do. Now, women, there are some more things, unexplained weight loss for both the sexes, bloating and heartburn could be a symptom for investigation. Changes in the size, texture, discharge, retraction of nipple are important. In between period bleeding should be watched for. Normally, a woman will have once in 28 days, and if there is an intermenstrual bleeding, that is important to watch for. And particularly beware of postmenopausal spotting. Many women, after the end of their periods, they come back at 50s, 55s. Doctor, I have again spotting, which could be endometrial cancer. Skin changes like scaling and pigmentation, blood in the wrong place, gnawing abdominal pain. This is not a very severe, but a very gnawing and then irritating abdominal pain, prolonged abdominal pain. Depression is one of the very important causes, particularly in women, and easy fatigability are important early warning signs. This video will be available for all of you along with the PDF. You can revisit them, carefully listen, and then understand the significance. Once again, I'm telling the presence of any one or more of the symptoms or signs is not a direct indication to diagnose cancer. It is an indication to take help, ask for the required investigations. Don't go yourself and do CT scans and MRIs or any tests. You are not empowered to do that. You have to consult your physician and they will order your tests that are required. Never go and stretch before the lab, test my blood for cancer or do MRI or CT, which many of the youngsters are today doing, as though I can't fix and do sort of a construction on my own of a building. I take the help of an engineer. Similarly, It is more so your body, and don't then go on. Some of these procedures are very detrimental too. Without your knowledge, you may be endangering yourself. So unless there is an indication, doctors have a protocols. They will follow the protocol and use your symptoms, observe for a while, and then evaluate and never jump. For example, somebody comes to my chamber with a headache. The first diagnosis will be a tension headache or cluster headache or migraine and not cancer. I wait and see, thoroughly examine, find out if it could be cancer, and then only I will do an imaging investigation. So I again warn you, people, please don't be carried away to do your own self-investigations. Don't be afraid that these symptoms are already cancer, and don't be complacent that these can be ignored. Okay, simple headache, I will wait for 1 year and then no, you will lose the time. Here, time is health. Okay, you can see here the trend of the population in India today. We are 140 crores or 1.4 billion around that, and by 2100 it is going to be 1.1, and beyond that the population is going to shrink because we have a small family norm. What does it mean? When the size of the population shrinks, the people here will be the one who will be 70s and 80s when they come to that point, and the aging population will result. This is what exactly. So you see the black line. This was the aging in 1990. So way more of younger population, very few elderly people, both men and women, men, females on the left side, males on the right side. And then in 2019, you see here the population is already aging. We have more aged persons here. FOSWL is a direct mirror of the aging of the population. We have many elderly persons here, thanks to the health awareness, thanks to the health interventions, thanks to the nutritious food, thanks to the safe water supply. We have conquered the infections, and we are living long enough to suffer from non-communicable diseases like diabetes, hypertension, heart disease, stroke, and of course, cancer. What is this orange line? By the end of this century, this will be our aged population. It will be an inverted pyramid, where most of the population will be aged, very few will be in the younger age, and this have to support the society of the aged people. So the changing risk of cancer will be a dynamic one because of the change in the population structure. IHME is International Health Metrics Evaluation. I do not know whether any one of you are aware of this. They give you the exact data on any disease all over the globe. India has got its own leg of IHME here, International Health Metrics and Evaluation. Now you see 2009, these were the causes of diseases, and 2019, they are shifting up and down. Ischemic heart disease, heart attacks, COPD, chronic lung disease, brain stroke, and nutritional diarrheal diseases, infections, tuberculosis. These are the communicable diseases, the red ones. Then you have the diabetes and then the liver disease. And those. If you exclude the communicable diseases, why I want to exclude? Because population like people who are the audience here, the chances of getting communicable diseases are smaller compared to non-communicable diseases. So look at this. This is the disease pattern, non-communicable diseases. In India, the first leading cause, of course, is cardiovascular disease, which is heart attacks, we all know. The second one is the chronic lung disease, and that is the COPD and asthma and related morbidities. And third one is the brain stroke. And fourth in the list is neoplasms. Malignant means cancer. Benign tumor means it is non-cancerous. These two words you must be familiar. Doctor will say it is a benign lesion. Benign means very innocuous, not going to kill us, not going to produce problems, and no radiation, nothing is required. At best, removal may be required. Malignant means it grows locally and also into the body and can produce problems. So 12% of our deaths due to non-communicable diseases as on 2020 are due to malignant neoplasms. Cancers are the fourth leading cause of death in India. In Western country, these are the second leading cause of after the heart attacks. Okay, enough is enough. What is the reason not to? So why don't I screen everybody in the community? Go to every village and screen for cancer. It's not possible. It is we have to go by a first level of screening, which are the age, family history, and all the risk factors I told, plus the presenting signs. They only are eligible for screening, and not everyone. Now, if I want to screen everyone, it will be very expensive. And number two, it will be harmful also because there could be some false positives and there will be a risk of procedures if we do universally. So we don't advocate universal screening for everyone. Sometimes people are too old. There will not be any benefit of screening them. The life expectancy itself is maybe 4 years or 3 years. They already have chronic liver disease or chronic lung disease or chronic kidney disease, and their lifespan is measured in number of years, 1 or 2 years, and there's no point in doing cancer screening. The health status may be so poor, they may be so too sick to be treated, even if a cancer is found. In such a scenario, we advise them what is called palliative care. That is, upashamana. We just give them relief from their symptoms. Patient may decline or refuse to be treated. Then there are some adamant people. Let it be. I don't mind. I would like to live with the problem rather than try get screened now, because if I get screened, I know I will get something bad. I have a patient who used to say, "Don't test my sugar." Why? He says, if you test my sugar, you will say I'm a diabetic. I don't want. So that is the adamance. So sometimes cancers are so indolent that matters little to diagnose them. For example, a thyroid cancer is one of the very slow growing. It can be detected once it is evident and symptomatic. You don't have to screen for that because it is a very indolent, means a very slow growing cancer. Sometimes it is too advanced and ineffective treatment like pancreatic cancer, one among the very powerful dangerous malignancies. Many great celebrities like Steve Jobs, they died of pancreatic cancer. It is generally asymptomatic unless it produces complications. That is the problem with that. So these are some of the reasons why we don't screen everyone. Now you see the normal cell, beautiful with all its organelle outside and circulating in the body. And you see the cancer cell, it is picturized red here. This is a electron micrographic photograph, a real-time photograph, and all its tentacles like thing. It is as though a crab in the beach, you would have seen the crabs crawling in the beach with, and then making holes and burrowing deep like creeping ulcer. The two words, benign, means not dangerous, does not grow fast, may not require aggressive treatment like radiation, chemotherapy. At best, it may require surgery. Malignant means it immediately requires attention. It will spread fast, and we don't want it to produce any problem. What are the most common cancers? We need to know what age do people typically suffer, and what are the screening tests? Where do you find the best advice? And at my age, is it still worth for screening? These are the questions that some of us might have. I try to answer some of these things. So there is one particular association called NCCN, National Comprehensive Cancer Network, and this is about the older adult oncology. We no more call old people or elderly. We are called, all of us are called older adults. That's a good thing. We are still adults, so we are older adults. And oncology means a study of tumors and particularly cancers. And then cancer is the leading cause of death in men and women above 60 years. It's the leading cause of death. Earlier we have seen it is the fourth cause when you take all the population. When you take 60 to 79, it is the leading cause of death. More than 50% of all cancers and 70% of all cancer deaths occur in people more than 65 or older. It is not music to the ears. By 2030, approximately 70% of all cancers will be diagnosed in people 65 years and older. That means what? As we age, we run the risk of getting a cancer. Doesn't matter. We are aware now. We will take care. We are not afraid. We have the warning signs in hand. Our physicians are there. They will take care. Now, if you look at the important cancers, one thing in men is called the prostate cancer. This is a diagrammatic representation of prostate and urinary tract. So this is the front part of your abdomen. This is the buttock part, and this is your urinary bladder in which the urine collects. And it is through the fine passage the urine comes out. And just below the urinary bladder, you have a gland called the prostate. And that gland normally doesn't interfere with the flow of urine here and doesn't obstruct. This is called the prostate gland. You might be seeing that. I'm going to underline that, mark it. That is the prostate gland. Okay. Why I'm showing the pictures? For you to understand. Normally, this is the urinary bladder here, and that bladder collects urine. Nicely, it goes down without any problem because the prostate doesn't interfere. But when you have prostate enlargement like this, it impinges onto the passage of urine and obstructs the flow. Stream will be reduced, frequency will be more, pain may be there, blood may be there. This is an enlarged prostate. Remember, all enlarged prostates are not cancer. It's a benign enlargement called BPH, benign prostatic hypertrophy, which requires a simpler treatment with medicines and rarely surgery. There is a malignant prostate. How do I diagnose that? By what is called DRE, digital rectal examination, and an antigen called prostate specific antigen. The doctor will do it. You don't have to ask for the test. The moment he sees the enlarged prostate, they will exclude that it is not malignant, particularly in the elderly. Now, coming to the GI tract, all of you in your biology, you would have learned that we have the small intestine here, and we have the large intestine, which is here. This is called, large intestine is called the colon, and the small intestine, of course, is there in the center. The large intestine is like this, like a beautiful figure, and you have the rectum. This is the pouch where the fecal matter is stored, and this is the opening. All of us know that. And colorectal cancer means anything from here to here up to the here is called colo. Colo is colon, rectum is this part. Colorectal cancer is one other very important cancer. So what happens? Instead of a beautiful free wall like this, there will be tumor masses inside the tube of the colon, which will interfere with the digestion, interfere with motility of the fecal matter. They produce blood, they produce diarrhea or constipation, alternating diarrhea and constipation, change in bowel habit, and blood in the stools. Maybe occult, maybe overt. Blood may be visible, blood may be invisible, microscopic blood. There are beautiful tests now to do it, and there is a screening available for both prostatic cancer and colon cancer. Now, there is another thing called the lung cancer. This is a beautiful normal chest X-ray, and you can see lungs are very clear. These are the lung fields, the black areas, and this is the heart in the center. These are the tubes of the air, that is bronchi, and they have no problem. And now you see here this man has got a mass very close to the heart shadow. This is called the hilum of the lung, and there this carcinoma or cancer of the lung. Smokers and COPD patients are notorious to suffer. There are screening techniques and rules for cancer of the lung. Now, look here again, I'm showing some data here. Prostate, lung and bronchus, colon, urinary bladder. In men, the leading cause is prostate, lung and bronchus, colon and rectum, that is called the colorectal cancer, urinary bladder, and of course, including the cancers of that. And in women, breast is the first leading cause, lung and bronchus, colorectal, and the garbhapai, which is the uterine corpus. Okay, now you see, you draw a line there, you have more than 50% of cancers occurring in those four organs, nearing around 55 on the men and 60 on the women. You can see prostate, lung and bronchus, colorectal cancer, and urinary bladder. And the probability of lifetime risk of cancer in men is 40%. In women, it is just the little lower, 38.7. This is a lifetime risk. I'm telling you, if there are 100 people, 40 of them will have cancer in their lifetime. And 38.7 of women, based on a very strong data and studies. Now, let us look at what are the most lethal cancers. Earlier, we looked at the occurrence of cancers. Now, the killer cancers, again, lung and bronchus, prostate, colorectal cancer, pancreatic cancer, very lethal, and here lung and bronchus, breast, colorectal cancer, and pancreatic cancer. Colorectal is the lower part of the large intestine. Large intestine is the colorectal cancer. Again, I draw a line. If pancreatic cancer doesn't give any warning signs, the first three, if I take care, lung and bronchus, prostate, and colorectal cancer, and screen them, around 50% of the mortality can be avoided. All other cancers are remaining 50%. Now there is a beautiful task force, US Preventive Services Task Force. It is available for the globe. It is not restricted only for the United States citizens. It is there for all of us. The website is given and also the website address is given. You can make use of that. Now, you see here men and women, again the same data, prostate, lung and bronchus, colorectum, urinary bladder, like that. Again, breast, lung and bronchus, colorectal, uterine body. So this is the man disease and the right side is the death. Again, you see, if you draw a line, we have taken care of around 60%. And by then, 65% of the deaths here. All this is to say, we have only 4 screening things. If we screen for those 4, 50 to 60% of all the cancers are taken. What are they? 1, cervical cancer. 2, colorectal cancer. 3, breast cancer. 4, lung cancer. And 5, prostate cancer. 5, in fact. Cervical, that is the uterine, the garbhapai part. And then the colorectal, that is the large intestine. Breast, of course, lungs, prostate. I explained what is prostate and which guidelines I follow. There are several guidelines. Go by US Preventive Task Force guidelines. What are they? Now, 75 and above, there are tests called pap smear and also, the screening for pap smear above 65. Usually it's above 75, you don't have to do, but the number of mammograms done, 62, pap smears, 57, colonoscopy for the colorectal, and PSA antigen, only 57%. That means not even half of them are covered in spite of the availability of these techniques. What is mammogram? I will show. Now, all sites cancer, 70 plus people, 32% in men, and 26% in women. Of course, it comes down as the age is smaller. 0 to 49, it is 3 and 5.8. And total, I told you, lifetime risk is 40% and 38.7% lifetime risk for all the ages. So the moment we are above 60, we have to be very careful for any of the warning signs, and then try and get the best medical help as soon as possible. The colorectal cancers contribute to 3.3% in men and 3% in women of the total number of deaths. Of the total number of deaths, 3.3%, which is a very high number of colorectal cancer. So I must screen for colorectal cancer. That is the large intestine or large bowel. Then what do? Every 10 years, we do colonoscopy or flexible sigmoidoscopy once in 5 years, CT colonography for once in 5 years, and blood in the stool examination every year. There are 3 tests available. There is a GAIAC-based test, there is an immunological test, there is a DNA test for blood in the motion. So what all we need to do is just give a stool sample and annually look for visible or invisible blood. Visible blood is already known. Immediately we have to seek help. Invisible blood, do GAIAC-based blood test. I mean, it's a test in the stool sample, and FIT, fecal immunology test. It is called immunogenic test, or we have a beautiful DNA test for the blood, which is called Cologuard, and that is a very, very useful and accurate test to detect blood. Every year, detect blood in the stool. Every 5 years, colonography by the CT test. Every 10 years, a colonoscopy. When? After the age of 60. Okay, so 45 years plus we start annual frequency of the blood in the urine, and then the multi-target sDNA every 3 years, flexible sigmoidoscopy, CT colonography, and colonoscopy every 10 years. Colonoscopy need not be done every alternate month or a week. Once it is done, it is normal another 5 years, unless you have symptoms. If you have symptoms, of course, again the indication changes. This is what is called the Cologuard I am telling, which is a DNA-based test to look at micro small quantities of blood. Normally, we should not have even a smallest drop of blood in our stools. And this DNA test detects that very efficiently, up to 94% accuracy. Now, the next most important is the colorectal, prostate, breast, and the uterine cancer and the lung. Prostate in men, 8.2%, above 70, 4.7% between 60 and 69, 7% above 70, 3.5% 60 to 69. Overall, men 11% of prostate cancer, 12.8% in female breast cancer. Men have an alternative. Men are endowed with prostate, they suffer prostate cancer. Women have the other organ, the breast. They are now suffering with the breast cancer. So this is what is called a simple test called mammogram. And the woman is just positioned like that before the mammogram machine. And this is a normal mammogram here. The right and left breast are shown up here. And these are all normal tissues here, glands of the breast. And if there is a mass like that and thick thing somewhere in that, or if there is any distortion in the nipple area, and that will be marked as probable cancer, and a biopsy will be done and confirmed. So we have to do mammogram. How frequently? 40 to 45 years, every woman should have the opportunity to get mammogram. 45 to 54, every 1 year. 55 plus, continue to do mammogram until the expected life is at least is 10 years or more, then you keep on doing the mammogram. If the expected life expectancy due to some other diseases is less than 10 years, then you may not do mammogram. And the help is available in the website www.cancer.org for all of these. Now, for the prostate, we said the most important cancer in women is breast cancer. In men, it is the prostate cancer. We know what is prostate. There is a test called the prostate specific antigen or PSA test. And if the doctor advises, take the test. There are some precautions before you do the test, so don't run on your own. They will advise what is called DRE, digital rectal examination. Doctor will have a gloved finger, and with the finger, he will look into the rectal and anal area to see that there are any masses which require further probing treatment. When do you do it? Almost 50 plus years. Every year it is better to get a PSA done, and also an ultrasound and a digital rectal examination also. Then what else about the test related to cancer of the uterus or the cervix? There is what is called the HPV test. Yeah, that is called human papilloma virus. HPV, human papilloma virus test, a PAP test for all men in the reproductive age. And 30 to 65 years, HPV test and PAP test must be done. 66 years, you may stop screening depending on the previous results, because if a woman doesn't suffer cervical cancer by the age of 66, it is unlikely she will have cervical cancer. So screening is rather not beneficial unless they have a postmenopausal bleed or some mass or discharge. But in general, for screening, we don't advise pap smear for people who are more than 66 years of age. So what did I cover? I told you about the prostate cancer, digital rectal examination and PSA antigen every year. And for the colorectal cancer, stool in the blood examination every year, once in 3 years, a CT, once in 5 years, an endoscopy, sigmoidoscopy, once in 10 years, a colonoscopy after the age of 45. Okay, now we came to the breast cancer. We have come to the breast cancer. We talked about the mammograms and how we do the mammograms. We came to the prostate cancer, that also we discussed. And now we have also talked about the guidelines for the uterine cancer or cervical cancer, which is called cervical means neck of the uterus or the mouth of the uterus is the one commonly affected. Sometimes the body of the uterus, the corpus, it is called corpus of the uterus, can be affected. Now, how about lung cancer? Lung cancer, there is no reason to screen lung cancer for everybody. Somebody has got symptoms, of course, a blood in the sputum, chest pain, or X-ray shadow, then of course they will be evaluated. But for screening, we will not do unless the person is a smoker or he is a COPD, chronic obstructive pulmonary disease patient. And then we use what is called LDCT, low dose helical computed thing, only in smokers and COPD patients. We need to screen not everybody unless they have the warning symptoms of lung cancer, as can be seen from that list of 18. Okay, these are the 4 cancers. So what, again, to summarize, we have got 4 important cancers which contribute about 55% of the disease burden and 60% of the death burden. These 4 are, to start with, in the women, it is the breast cancer, colorectal cancer, cervical cancer, and of course the lung cancer. In men, it is the prostate cancer, then it's colorectal cancer, and then of course you have the colorectal cancer, prostate cancer, and the lung cancer. These are the screenings available. And there is another entity called endometrial cancer. And this is again the corpus or the body of the uterus can have a sort of cancer, and that is the endometrial cancer. And now you see there, this is the normal body of the uterus, and this is the cavity of the uterus, and if cancer develops there, that is called endometrial cancer. You see here, and these are the ovaries, sometimes ovarian cancers also. You may ask me, are there any blood tests for detecting cancer? For diagnosing, yes. And for prognosticating, yes. For confirming the diagnosis, yes, not for screening. Not for screening except the PSA antigen test. Okay, now, so when there is an endometrial cancer is suspected, the woman will undergo a pap smear test, a HPV test, and in the birth canal, the ultrasound probe is kept and the uterus is imaged through the probe there kept in the birth canal. And the endometrial samplings also will be obtained and tested, transvaginal ultrasound and endometrial sample. Okay, now if I do all that, what has happened? 75% of them are still asymptomatic and 25% are standard of care. 25% of cancers are detected by screening, 75% we have to wait for the symptoms and then start evaluating. In these 25% are without symptoms. I don't have any of the 18 listed, but I go for the screening technique. Whereas 75%, if you have any one of those 18 symptoms, of course, we try to evaluate. That is called diagnosis. And screening is not when you have disease, when you are in health. Diagnosis is when you have symptoms, when you are suspected of disease. Okay, now, come on. Now, 30% of cancers are diagnosed by screening. Remaining 75%, we have to wait for the symptoms. And the sooner we go with once we detect the symptoms to the healthcare provider, you will be better served by them. This is, remember, so asymptomatic, healthy, don't have any issue with your health, still you require the screening if you are 45 plus with all the 4 diseases: prostate cancer, breast cancer, colorectal cancer, uterine cancer, and lung cancer. 5 things I told, out of which breast and prostate will not occur in the same person because gender based. So we have 4 cancers to be screened for men: colorectal cancer, prostate cancer, and then your lung cancer. And then these are the important things. Whereas in women, you have the breast cancer, you have the colorectal cancer, the uterine cancer, and the lung cancer. So these are the things that I have here. And you see there is a vaccine. Can I prevent cancer with a vaccine? Can I prevent COVID with vaccine? The answer was no around 2 years back. Now it is yes. Like that, there is one vaccine which is called the HPV vaccine. HPV vaccine is human papilloma virus. This human papilloma virus vaccine should be offered to every girl when she is going, before she has the first sexual contact. That means the moment she attained her age, this should be the gift given by the relative or a parent to give her a full course of HPV vaccine. And this HPV vaccine prevents at least 6 types of cancers, and 4 out of 5 in the population are HPV infected. It is a virus, and that causes the cancer. What are the things that it can prevent? Cervical cancer, that is the uterine neck cancer, and then the cervical precancer, oropharyngeal cancers, anal cancers, the private part cancers, and of course, the men private part penile cancer are prevented. Should men take it? Yes. If they are sexually active, they must be protected from HPV virus, and HPV vaccine has to be given. It is very easily available. Ask your provider, they will give you the HPV vaccine. Is there any other disease which I can prevent? Yeah, the liver cancer can be prevented by taking HBV vaccine, hepatitis B vaccine. If you are not vaccinated against hepatitis B, you take HBV vaccine and you will be protected from HPV virus, and HPV virus is the commonest cause for liver cancer. So there are 2 HBV and HPV. As of now, only 2 vaccines are available. But you remember, look here, World Health Organization has said 20 diseases can be prevented by immunization: COVID, cervical cancer, cholera, diphtheria, Ebola, hepatitis B, influenza, Japanese encephalitis, measles, meningitis, mumps, pertussis or whooping cough, pneumonia, polio, rabies, rotavirus, rubella, German measles, tetanus, typhoid, varicella, and yellow fever. How many of us have taken the relevant vaccines for ourselves? Go and approach your healthcare provider. Doctor, I know there are 20 diseases which are preventable. I know Ebola is not in this country. I don't have to worry. But Japanese encephalitis is also not a big problem. Yellow fever certainly is not a problem here. But the rest of the things, I must be protected. Then not only the infections are protected, some of these, particularly the HBV and the HPV vaccine, these are protecting the cancer also. Okay, now there is what is called the Thrive, an organization. There is a test called coming up is called the Cancer Seek. And this is a simple serum test from the based on the blood. And if this comes into the picture, it can diagnose many cancers. It is in the pipeline. Anytime we will be able to get it. It is still not available for patients' use. Patients and providers, Cancer Seek is not yet available to patients. Stay tuned for more information on this. Upcoming clinical trials are going and results are published in April 2020. More than double the number of cancer detections through the Seek. And Seek is not approved by the international agencies like FDA as yet for use. I may close my talk with 1 or 2 important messages. CDC short video clips are there. Those who are interested, I will share the video clips. And there is also a life expectancy calculator. Some of us would like to know, instead of asking the Jyotisher to look at the hand and tell how many years of life I am left, you have a beautiful computer-based models based on the data to calculate the life expectancy. Raho cancer se do kadam aage. Beat the cancer by being 2 feet ahead of cancer. This is the slogan, and these are the various websites from which the information has been collected for our talk here, and you can visit. This will be available for you, this presentation, and also you have the common key websites where you can, the earlier ones are videos, and these are all the various websites which we have utilized to bring in those things. Now, I will just share that 1 or 2 minutes videos for you so that it becomes that is the end of the talk. And yeah, you should be able to hear. I will put it in full volume so that you will be able to hear that. That doesn't mean you should anyway, I have introduced this to you. You can later on also watch. Like that, there is another video that you need to watch. And this again tells you the same story, whichever I have narrated. This is another video about elderly cancer. Okay, I'll share the video links to you. You can at leisure watch. I have something else to offer that is about the how long will I live. So for example, if I tick the gender male and then race as Asian and age 69, weight 144 lbs, height 5.6, education, college graduate or more, marital status married, are you retired? Yes, income earned when working, some dollars, whatever it is, fitness, exercise I do 5 days in a week, general health, very good. And do you have diabetes? No. Alcohol 0, smoking never, then it calculates a life expectancy. And this is every one of us, you can try it, and it gives you an expectancy of, for a person of that description, it will be 95 years will be the expected life. And it is your life expectancy is 10 years greater than most of us. Great job, but you will spend hundreds of thousands more because you live that long and plan for that. That's what they're saying. This is a simple calculator, and I will show you another calculator. I'm not going to do this calculation. It has got more than 5 or 6 pages, asks every little bit of the details from you and living to 100. And it will also give you a feedback how you can modify the things that are negative in your life now to live a better quality of life as well as duration of life expectancy. With these few words, I might try to close my talk, but then again, I have a slide for you, which will be the last one of my talk. So this is where we went into those videos, and then also we had the websites, and finally, wishing you all a very beautiful, healthy, cancer-free, disease-free life. And we have an onus with us to protect ourselves and be healthy. Rest is in the Almighty's hand. If you have any questions, nothing specific about any disease you or your kids have, but general questions, I am prepared to take up. I thank my brother and also the head of this organization for this wonderful opportunity. My pranams to all the senior and junior FOSWLs. And thank you so much for this wonderful time. I just had 1 hour, and that was very well utilized, I feel. I thank the Almighty for the opportunity. Om Purnamada Purnamidam Purnat Purnamudachyate Purnasya Purnamadaya Purnameva Avasishyate.